Well, thank you very much. As we all know, Dupuytren disease has a variable presentation in patients, and furthermore, the disease course over time differs per patient. Previous studies have shown that progression of disease is apparent in almost 35% of the patients after long-term follow-up of 18 years, and it was also seen in 50% of patients after follow-up of almost 9 years. However, these studies only had 2 moments of measurement, so one at baseline and one after the moments of follow-up. So the disease course over time was not investigated in these studies. That brought us to following research questions. What is the natural disease course of Dupuytren disease over time and patients with primary DD? And which variables are associated with this disease course? And we had the hypothesis that, for example, age, severity of disease, and gender, and other well-known risk factors for DD would influence the disease course. We designed a prospective study in which participants were clinically examined every 6 months, and in this presentation I will present you the results of 2 years follow-up. We measured the area of nodules and cords in squared centimeters with the tumorimeter as shown on the picture. We tested the inter and intra-observer reliability of this method, and it's shown in one of the posters in the conference area. We measured the extension deficit, and we used the classification of Dupuytren to classify the severity of the disease. Descriptive statistics and latent class models to study clusters in change profiles. Almost 250 patients participated with 370 affected hands with primary DD. The majority of participants was male and the mean age was 66 years. And I have to mention that a contracture was present in almost 60% of the race. In this table, I'll show you the median area of DD and the median total passive extension deficit of the first 4 measurements. And as you can see, the area as well as the flexion of the extension deficit stayed fairly stable over time. And there is a large variance between participants as shown with this wide interquartile range. And we think that this broad range between patients, large variation, also explains why the median stays stable over time. So there were differences between patients, but the median stays equal. And this made it very hard for us to study really minimal changes for the individual patient. Therefore, we studied whether there were clusters apparent in change profiles over time. And we did this for the area for all fingers. And we saw that there were up to 6 clusters of patients that showed different disease course over time. And we mainly saw an increase in 5 to 40% of patients, stability of disease in a large group, but also a decrease of the disease in 2 years of follow-up. And there was no association with the well-known risk factors between these groups. And here I show you some pictures of 3 of left fingers and 3 of the right fingers. They are available for all, but beyond the scope of this presentation. And then you see different number of clusters for the fingers with progression, stability, and even regression of disease in 2 years of follow-up. And also you can see that some patients seem to vary over time, and we studied this is beyond the measurement error, so this is true fluctuation in time. We also did this for the extension deficit, however only available for the ring finger and the little finger because there were too little contractures in the other fingers to study this. And here we saw up to 3 clusters. And again, you see some progression, stability of disease, and also regression in extension deficit over time beyond measurement error. When we compare this to the studies I just mentioned, you see when you take a close look at these data that also in these studies regression and stability of disease was seen. However, fluctuation over time is really a new finding in our study on short-term disease course in patients. So, in conclusion, DD is not always a progressive disease. Up to 75% of patients has a different disease course over time. And there's no association with well-known risk factors and disease course. And we think it's valuable to take this in mind when you evaluate the effects of treatment for early phase DD, such as radiotherapy or splinting, to study whether it's really effect of your therapy or whether it's just natural disease course what we're looking at. And you should also take this into account when you're designing future studies. Thank you.